So good afternoon, everyone. I am Dr. Bijnya from AIOS Bhubaneswar, and I will be presenting my survey on practice patterns about the management of oculoplastic conditions in the preoperative period among Indian ophthalmologists. So, according to the literature, the prevalence of oculoplastic conditions varies from 1.4% to 7.4% of new eye patients, all presenting to a eye clinic. And the presence of these oculoplastic conditions along with a patient with glaucoma or cataract or any vitreoretinal condition that affects the surgical planning and the outcomes. And these post-operative outcomes have an impact on the patient satisfaction as well as the ophthalmic surgeon reputation. So as the preoperative management practices varies among the ophthalmologists, that is a diverse practice pattern, we need to understand how the concomitant oculoplastic conditions are managed by the general ophthalmologist and the subspecialty surgeons. So our goal was to identify the common practices and the potential gaps if present, and the potential for any standardized care could be performed. So this was a cross-sectional questionnaire-based study between April and June 2023, and it included around 180 ophthalmic surgeons all over India. Ethical approval is obtained, and the data was analyzed using excellence data. So this was the proforma we gave by Google Sheets to all the ophthalmologists. So these proforma included questions related to the demography and about the oculoplastic conditions they see in the OPD, and how they manage these oculoplastic conditions before sending their patients for any subspecialty surgery. So the participant demographics included 52.2% of female ophthalmologists, majority in the range of 30 to 40 years and within 5 to 20 years of practice, mostly belong to the urban areas. The ophthalmologists were mostly comprehensive, and they were also fellowship trained subspecialists. So regarding the oculoplastic practice patterns, like how many oculoplastic conditions they see in the OPD and whether they manage on their own or they refer to any specialist. So, according to the results, what we found was that around 43.8% they referred the oculoplastic disorders to a specialist, and only 16.3% they practiced exclusively their subspecialty, and they referred all patients to the specialist. So regarding the concomitant lacrimal conditions like chronic dacryocystitis NLD obstruction, 49.7% preferred Roplas testing as the sole screening procedure, and 63% favored dacryocysto-rhinostomy before they sending the patient for cataract surgery. And 13% around they chose punctal cautery or they proceed with ocular surgery in asymptomatic cases. So in partial NLDO, around 50% they proceeded with ocular surgery in asymptomatic cases. Most of the ophthalmologists, they favored a gap of at least 4 weeks before any subspecialty procedures. Regarding the eyelid malposition management like entropy or ectropy or ptosis, 43% favored surgical treatment prior to the subspecialty surgery. If the thyroid eye disease was present, around 47% they treated the patients in selective cases only, and rest proceeded for the ocular surgery. The anesthesia they preferred before doing any specialty surgery was the topical anesthesia. So most of the ophthalmologists, they treated, around 97% treated all cases of periocular infections like lesion, stye or canaliculitis before doing the surgery. So the limitations of our study was that it included only the Indian ophthalmologist and the global perspectives were not considered. There was a small sample size, and there were some questionnaire gaps too. So to conclude, there is a variability in the practice patterns which reflects the diverse training backgrounds of the ophthalmologist. There is a need to integrate comprehensive oculoplastic training in all residency programs, and there is a call for standardized guidelines and collaborative efforts among subspecialties. Thank you.
This term, common practice patterns, it has a very significant value in medical legal cases. In your questionnaire, what it was related to? Only dacryology?
All the oculoplastic conditions,
all of the oculoplasty. Because just 180 consultants we are almost 12,000 attending here,
Right.
to 18,000 All India Ophthalmology Society members. More than this are which are not even society members. So almost we can say 30,000 ophthalmologists working in India.
Right.
We oculoplastics, I am an oculoplastic surgeon. So our oculoplastic society as such has 1400 members.
Right. So I'm also an oculoplastic
Yes.
surgeon.
So-
So I
that is
wanted
what-
to
that-
take
that
it
is why-
into the
that is why-
oculoplastic
that is
group
why, because
also.
if you are a oculoplastic surgeon, your role was supposed to be little more concise. Maybe just on one point, okay, yes, if there is a epiphora, what a general practitioner do, what a
Yeah.
ophthalmologist do, and as
Yeah.
such, or when they have to decide for a surgery.
Hmm.
Like in your case, you said, okay, 50%, even if the infection is present, NLDO partial or complete, they proceed with the cataract surgery.
Surgery, yeah.
If there is endophthalmitis there, it is indefensible.
Hmm.
That is what I said, this common practice patterns is a very critical term when medico-legal cases are there.
Okay.
Fine.
So
if
that
we-
is why I'm telling there is a need for creating these guidelines which should be followed by
So
all
best
ophthalmologists.
best will
Still
be
now
to
it
have
has not
one
been there.
condition in case this kind of a practice patterns you want to actually study, because difficult to study the entropion, ectropion.
I was
Right.
going
etc.
to ask
in
you.
one case,
I was
in
going
one
to
case
ask you the
study.
same question.
Ah.
In other words, that what was the purpose of this study?
Purpose of the study.
No,
yes.
like chronic dacryocystitis have been majorly studied in all,
That
like
is what
whatever
we are-
literature
that
is
what we are
there.
emphasizing.
That is what he's saying. If you take
That
one condition one by one,
only,
we can
one
conclude.
condition, because it has
Yeah.
a value.
We can conclude
Like
something.
The
in her
eyelid
presentation-
malpositions like
like in her
ectropion or
presentation,
entropion.
She concluded that yes, steroid sparing immunosuppression and referral to rheumatologist is very essential, isn't it? That is what her study definitely concluded. But in your initiative, you have taken some initiative, yes, it should be pinpointed initiative, so that if suppose these guidelines or these things comes to a resident, at least they get something out of it. Because at the moment it is not able for me, I'm not able to digest that partial LLDO 50% will operate.
Yeah, if
Fine.
symptomatic,
That is what I'm saying.
then we
Again,
operate. Yeah.
partial NLDO, fine, whether symptomatic, asymptomatic, unless and until you have taken a consent from the patient, okay, yes, there is a high risk
Yeah.
of developing an endophthalmitis, because no one will operate.
But I think
Yes, sir.
it gave her a lot of information as an oculoplastic surgeon that what general ophthalmologists are doing about different conditions.
So I wanted
That
to
would be of, I think,
find
interest
out
to you.
that only.
So-
So how
so
they are treating, whether they are treating the ectropion or entropion or not, because that has also a very important role.
So that is what I'm saying. Okay, with this is each topic-wise questionnaire, so that we get some answer out of it. It
So
is not
the
that we
questionnaire
include-
was included because of lack of time. I
Anyway,
could not
as
show
of
the
this
questionnaire.
presentation, I'm talking of this presentation, including so many things in one questionnaire, and then asking the practice patterns is, I don't know, has served a purpose.
Because she is an oculoplastic surgeon and she was interested in what general practitioners are doing about all the conditions. How
Yeah,
many
for
they are
the
referring.
oculoplastic
Anyhow,
conditions,
anyhow,
how
good
they
initiative,
treat.
that is
That's
what
all
I
right.
said.
Good.
Good initiative.
Thank
Thank you.
you.